is task number 1. So we have gathered up our vacuum containers and labeled them. So we have our serum separator, and then we have one with our anticoagulant in it, and then just a plain tube. So we are going to go ahead, put our needle onto our syringe. And then Caitlin's going to go ahead and hold for us. And we're going to go ahead and put some alcohol on Winston's leg. I know, Barney. That's going to help us locate his vein a little bit better. And we want to use our thumb to stabilize the vein, and we are going to insert our needle, bevel up, and just gently draw back. We want to go nice and slow so that we don't collapse this vein. For our paper, we want to fill our tubes at least 90%. I know, buddy. So we're going to go ahead, apply some pressure, and then Caitlin's going to take over for us. So we want to go ahead and let that pull into our tube so that we have the correct amount. And invert it so that it doesn't clot here. Go ahead and put the rest of our blood into our serum separator. And we're going to go ahead and we're just going to dispose of our syringe while we invert our tube here. And then this one here we're going to allow to clot. So while this one is clotting on our counter here, we are going to go ahead and put these two on our rocker and turn that on to keep them from clotting. And then as soon as our sample has clotted, we'll be back for the next step. Okay, so I previously stated we were going to put 2 tubes on here. However, our other tube needed to clot as well, so it was placed over here to clot. So now we're going to just use some sticks here, and we're going to go ahead and rim our clotted tube. So to do that, we're going to gently insert our wooden stick here and just gently go around the outside, pulling it away from the glass. And then we're going to go ahead and place our top back on. And we're going to get our matching tube here, and we're going to place them in the centrifuge. Okay, and then we are going to take our second tube, gently remove the top. And we're going to rim this one as well, just gently removing it away from the edge of the tube. Okay, we're going to place our cap back on there. We're going to go ahead and place those in. So then we're going to take our one over here on the rocker, and we are going to go ahead and place this in here as well. And then we're going to go ahead and close our lid And we're gonna set this on for 10 minutes so that it can go ahead and spin. Okay, so our centrifuge is finishing up, so we're gonna go ahead and label our empty tubes with Winston's name and today's date, and then we are going to label them for plasma and serum so that we know what we're putting in each tube. Okay, so we're going to put our plasma in those 2 tubes. And then this one we're going to put our serum in. So I'm going to mark that. And then we're going to go ahead and take out our first tube. Okay. So as you can see, it did kind of hemolyze. So we're going to gently take our top off. We're going to open one of our plasma tubes. And we're just going to use a pipette. So just gently pull out our plasma. We don't want to get any of the clot. And just gently put that in there. Now it may have, that's, looks like about all we're gonna get there. So it may have hemolyzed due to, possibly drawing the blood too slow or not letting it clot enough. So now we're going to go ahead and take our next tube, remove our lid. We're going to go ahead and take out our serum and put it into tube here. Oops, we need a new pipette. Sorry about that. So we're going to get a clean pipette. And we don't want to pull up anything other than our serum. And I'm going to gently place that in there. And I know that our tubes are extremely large. Unfortunately, they sent us large ones and we don't have any small ones left. If I can get my lids correct. So we're going to take our last two. Okay, so now we're going to grab our last tube, which is a plain red top. So as you can see, we've got our separation. So we're going to take our lids off of our tubes gently. Use our pipette and just gently pull up and transfer into the other tube. And like I said, our tubes are a little big to transfer into, but that's all that we have at the moment. So now we're going to go ahead and place our lid on there, place these together, and then we'll go ahead and package those to go out for testing. So on our computer screen, we have some examples of what should be normal. So we would look for like a clear color. Hemolyzed, as you can see, is kind of red, which is what ours look like. And that can be destruction of red blood cells, bacteria infections, parasites, autoimmune, toxins, and genetics. Can also be caused by like the collection method if you go too slow. It can give you incorrect testing results, such as like an increase in potassium. So then we have our lipemic, which on there looks kind of gray. And that is like an abnormally high concentration of fat. And that can be caused by not waiting long enough after a meal to dry your sample, administration of a synthetic lipid, and different medications. And it will also give you inaccurate test results if you were to send any sample in that was not collected properly. And that's the end of our test.